Now I want to check in with Dr. Jason Vieder. He is the head of the ER department at Henry Ford Health. And Dr. Vieder, thank you so much for being with us. I am guessing you are busy.
Certainly. Thanks for having me, Kim. Yeah, it's busy right now. It's always busy in the emergency room, but of course, right now we're most concerned about cold-related injuries.
And talk about that because people think of frostbite, but I know you're also seeing some slips and falls as well. Let's start with frostbite. With the next 48 hours, wind chills below zero. We know that exposed skin can obviously be vulnerable to frostbite. What's the rule of thumb for you? How long can you be out in this weather?
Yeah, it's really important to make sure that you are layered in your clothing. The best way you could do it is to have 3 layers of clothing. The layer of clothing closest to your skin should take moisture away. Any sort of moisture would increase your chance of getting cold-related injury. In between your skin, or I should say after your skin, you want an insulating layer. And then, of course, on top, your winter jacket, something that will keep the elements away from you. Uh, as our temperature goes down, the risk of getting frostbite can increase. Once it gets to 0 degrees, if you're outside for about 30 minutes without proper clothing, you could get some frostbite. As we get below to like -15, it could take about 15 minutes. So making sure you're properly dressed, wearing a hat. You can lose about 30% of your body heat through your head. So you want to make sure your head is covered, your ears are covered. The areas that are most at risk are places like your ears, your nose, your fingers and toes. So you really want to make sure you're really well covered.
And is there a certain age group that's more vulnerable than others? Are children with their extremities being so small, are they more at risk? Is it the older population? Who are you seeing in the ER?
People that are more at risk are older people, people who have heart problems, people who are smokers. These are folks that sometimes their blood doesn't flow as well through all the different parts of their body. So it's not necessarily that kids are more at risk, but kids sometimes are going to be more risky in their behavior. They want to play outside in the snow. They don't want to come inside. So it's really important to make sure that if your children are outside playing, they're taking breaks, they're really well covered, and that they're staying warm so they don't get any sort of cold-related injury.
I have a term for what I call my teenagers. It's called coatophobia. It doesn't matter how cold it is. I see my high schoolers in hoodies regardless. They will not put on a coat. Thank you so much, Dr. Vieder. I know you're very busy, so I appreciate you taking time for us. And I guess the key takeaway is just keep that exposed skin as covered as you possibly can. Thank you so much again.